And now, for a moment of clarity.
1.8 million people are enrolled in Indiana in Medicaid. It covers 1 in 6 adults ages 19 to 64, covers 3 in 8 children, covers 2 in 3 nursing home residents, covers 41% of births. Would you vote for a bill that has any cuts to Medicaid?
No, we tried to improve it. Actually, Indiana just recently, and our liberal newspaper had articles, $3.5 billion was stolen of Medicaid by nursing homes, by hospital, building Taj Mahals and stealing from seniors. But actually, that was Biden rule that allowed now upcharge federal government for Medicaid at the private insurance rate and cut services. And since Congress doesn't look at spending, they directly just funnel money from the federal government. So we actually want to make sure that Medicaid is better for the people that it's intended to. And then let's think how the rest of it is going to work, how we can make health care more affordable. And that is something executive order. I mean, President Trump doesn't get a lot of credit for it, but his executive order on price transparency in February can really change the dynamics. And I think that should be a bipartisan issue. But unfortunately, machine here is very powerful with money and a tax.
I think one of the interesting aspects of the Medicaid discussion that, as I said at the beginning, sort of will translate into how within the Republican caucus the members look at what a cut is and what it is you are cutting. And so right now there is a discussion about what is a benefit cut. And it's a very interesting reporting that basically if you ask most people, when you talk about a cut in benefits, it would be a cut in the benefit I receive from the program, right? So it's either, some type of medical service or other benefit that I get through Medicaid, which, again, for the record, is not just for the poor. It's also for those who with disabilities. It's also for a lot of our veterans are on Medicaid for a variety of reasons. So it is a very complex issue. But the benefit cut question for me is an intriguing one. You had Senator Josh Hawley of Missouri saying lowering the federal match to states and imposing per capita caps may well be benefit cuts, right? Leaving Missouri with a choice of slashing programs, raising taxes, or throwing residents off Medicaid. If so, he's not voting for that. But then you have Chip Roy from Texas saying that the aggregate Medicaid spending is likely to rise in the long term, even if those restrictions are implemented. Therefore, it should not be construed as a cut. I align myself with Josh Hawley because at the end of the day, if you're capping benefits, right, or if you are otherwise redefining what those services are, you're directly impacting what each one of those beneficiaries is going to receive. How do you see the question of benefit cuts? And it really kind of aligns to what Alicia was asking. How do you define it like Josh Hawley, or are you defining it like Chip Roy?
Well, listen, I'll tell you, we're actually not cutting benefits at all, because the problem is the benefits are very low. The providers pay very little. What is happening on top? Insurance and hospital making money on top, and they build in Taj Mahals, defrauding Medicaid, taking money from nursing homes and pay salaries to CEOs.
Catch Michael Steele on The Weeknight, Monday through Friday at 7 Eastern on MSNBC.